Hi there, thank you for joining us today for a special edition of the American Society of the University of Haifa's weekly public health coverage of COVID-19. We're delighted to be joined by Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership. And this week, we're also delighted to be joined by Juan Chingolani. He is an MA student that's currently enrolled in our public health program. So with a recent spike of interest from students around the world into our public health program, we thought this presented an invaluable opportunity to tell you a bit more about the program itself and what the future of public health might look like. So first off, Dr. Green, Juan, thank you both so much for joining us today.
Thanks, James. How are you?
Thank you.
Great. Dr. Green, I want to start with yourself. And really, I just want you to tell us a bit more. I mean, can you describe the ways in which the pandemic has amplified the importance of driving more students towards degree programs in public health?
Thanks, James. I think, unfortunately, sometimes it takes a crisis, as they say, to create an opportunity, but public health has always had its ups and downs, and usually it comes to the fore much more when there's a crisis, although it should be maintained at all times. And certainly this COVID-19 has not only created interest, but I guess that virtually almost everybody's become a kind of an epidemiologist, as a hobby almost, and a public health specialist. And has started taking interest. And I don't know whether that or other reasons, but we've had a very much increased interest in all our public health programs. And there's much more, many more students are registering now for the public health programs than in the past. So I guess the one is related to the other.
Great. So I guess following on from that, let's get some first-hand perspective. Juan, what inspired you to enroll in University of Haifa's International MA program in public health?
Well, from my personal motivation comes from living in Argentina and traveling around South America and being able to see how inequalities and lack of access to healthcare impacts on people's life. But specifically to this program was the quality of the professors and the recognition of the university and this program internationally.
Excellent. So I'm going to move on, and Dr. Green, I'm going to come back to yourself. So University of Haifa's School of Public Health places an emphasis on studying the plight of vulnerable populations. So again, how does this focus align with the current challenges faced by vulnerable populations during the pandemic?
Yeah, I think our focus always has been on vulnerable populations and what we call inequalities and inequities, particularly the inequity where it's unfair distribution of resources and an unfair inequality in health. And so we've focused on that in all our programs. And the inequalities or inequities can be a wide spectrum. They can be amongst minorities, where a minority could be a religious minority, it could be a socioeconomic minority, and also sections of the community, including women and the elderly, who sometimes are discriminated in terms of health and health care. And so, although some would argue that men are discriminated against, but we look at that as a possibility of looking at different segments of the population to ensure that everyone has equal access to healthcare and access to better health, to health promotion, basically, and to be healthier, which covers basically everything in society.
Right. I guess, similarly, Juan, has the pandemic changed the course of your studies in any way? And if so, how? And also, within that, what are some of the most striking aspects of studying public health while a global health crisis is taking place?
Well, in the first place, of course, our studies have been affected, just as everybody else's life. We moved from a classroom-oriented program to an online learning program. In my opinion, quite successfully, since we were able to get access to all the knowledge and courses that we were supposed to. And in a second place, we had a great opportunity to learn more about pandemics, since we have been researching on it since early in February and during the last weeks of February, because Professor Green was already working on it and he asked us to help him with that. And also during all the semester and the months of the lockdown, we had special seminars on COVID-19, and in which we had many different role plays in which we could observe the current pandemic from every different actor perspective.
Right. Right. So, in more practical terms, Dr. Green, can you explain how the academic study of public health ultimately translates into the formulation of real-life public health solutions?
I think the most important thing to remember is that public health, as I mentioned, is really, it crosses many disciplines. And it's actually basically everything that can impact on the health of the society or the individual, which is both the economic aspects and the social aspects, and of course the health services, and then many other things. There are certainly things like war and conflict and so on that are all impacting on health. So I think that what we have been seeing now in this COVID-19 pandemic, and where the students have been actually actively involved in learning about it while it's going on, is in a sense a unique opportunity. It's not something maybe that we would have wanted, but actually that's in practice what's happening. And their experience is unique, as we said. So I think that in practical terms, I think they'll have a much better grasp of how you apply public health principles to crises in public health and also to public health in general, and particularly to public health emergencies. And public health emergency is something that is impacting on a large scale anywhere. It could be a drought, it could be floods, it could be earthquakes, and it could be pandemics or epidemics. So they've heard about the Ebola epidemic in Africa, but they couldn't really experience it. I mean, it was something they'd heard about. Here they're basically experiencing this. So this is really unique. And I think that this is something that is going to strengthen their knowledge and understanding.
Coming back to you, Juan, can you describe any notable similarities and differences in the public health landscape between Israel and, you mentioned your native country, Argentina? And also, expanding on that further, what is the most important thing you've learned about Israel since you began studying at an Israeli university?
Well, I would say that the similarities I find between Argentina and Israel might be more on a surface level, since our health systems are alike, but only in a surface level, as I said. When you go to on a more practical way, Argentinian health system is not as egalitarian and as the Israeli one, because access to healthcare, if you are not from a, let's say, from a wealth family, becomes a complication. And I would say that is also the biggest difference with the Israel health system. And for me, one of the most important things I learned since I'm in Israel is the importance of diversity and how embracing it leads to better outcomes and a more smart way of living and improving people's life, for sure.
Great. Before we finish this, and Dr. Green, I want to get to you to just expand on what we just spoke about, and if you have any closing remarks. We touched on already how we've experienced an increase, a spike in interest into the public health program. I just wondered if you had any message to our listeners right now, to basically increase the access to education that we're experiencing through this spike.
Right. I think, and I hope that Johan will agree with me, but I think that our students will have a much better understanding of how this health system succeeds and fails under stress. And we've seen both. We've seen the health system do great things, and we've seen the health system fail. Fail, for example, to give treatment and care to people who didn't have COVID-19 and were afraid to come to the health services. So this is something that I think they're getting from the program. Can I just show a couple of slides of our program just to give you an example?
Oh, please do.
So let me just go and show you. We've got this one-year program, and anyone can get this on the web. But basically, I think the advantage of our program, first of all, we don't have large classes, so we have a relative maybe 20 students in the class, and then we've already this year had more than 20 students accepted for the coming year, and we are actually trying to decide whether we should limit it because we have somewhat more applications this year. It's accredited in the United States, so it's gone through the whole accreditation procedure. It just means that it's really strictly organized and also monitored. We've had now students from 25 countries in this program, so you see a lot of combination of students. It's in Haifa, which is great. The standard program is the standard thing, but I want to actually emphasize that what we do give are global health systems. We give a lot on leadership seminar, which you don't usually have in a program. And we do things like drugs and society and global strategies for maternal health. So we do focus very much on the global issues. And this COVID-19, I think everyone will agree, is a real global issue. So it actually could be used almost as an example virtually in any of our courses. And this is what's been happening. The students now have actually had, I think they've had 3 workshops on COVID-19, if I'm correct, one, and then there's another one that's due in a couple of days' time, where the students actually run the workshop and actually take actual role play, where they actually take on decision making. And that's what we want. We want our graduates to be able to get into situations where they understand what their tools are, what tools are necessary for actually making decisions in the public health and global health area. And hopefully we're able to, in this even short time of 1 year, give them a lot of these tools. Maybe Jan, we could make one final comment.
Yes, of course. This last seminar on COVID-19 is this Wednesday. I agree with Manfred in that the whole program is focused on understanding health as a global dynamic, which allows us to come from any background and still have certain things in common. And maybe the big challenge for us now is as to where to go after this, because the skills and competencies we acquire allows us to choose from a very diverse range of possible career paths. I also think that since our professors are all still active in their as researchers, we constantly get offers to collaborate with them, and that keeps us constantly updated on what's going on in public health worldwide.
Terrific.
So
Well,
James, I just want to make one quick comment that we're still accepting applications for our coming program in October. Okay.
no, an important comment to make. Terrific. Thank you both so much again for joining us today and providing us such an insight into the course, into the ever-evolving public health industry. Thank you also to our audience today, as always. If you have any questions, please do leave them in the comments section of this video or email them to info@asuh.org. As always, for more information on the university's work around the pandemic and to support programs like our amazing Masters in Public Health, please do find a link included within this post. During this time, your support will enable us to ensure more students have access to education and help the University of Haifa provide more of the leaders of tomorrow that we need now more than ever. Thank you all so much.
Thank you, James. Thanks, Juan.